Hi, this is Hillary with the Nurse Preceptor channel. I have a short and sweet video for you today. This is video number 10 out of my 30 Preps in 30 Days series in honor of September, which is National Preparedness Month in the United States. My topic today is PPE supplies that you'll want to have for your home medical kits, how you use them, and what they're good for. And I'm going to try to just make it really quick today, okay? I encourage you to hit the bell and subscribe to my channel if you'd like notifications of when my next videos come out. I have a lot of content, trying to keep it kind of short for each video so that I'm able to give you more topics to choose from, and you can pick and choose what you need to focus on for your own medical preparedness and in order to become less dependent on this very broken medical system. Now, prior to 2020, we probably didn't commonly know the phrase PPE, or you wouldn't have had much of an idea of what it even stood for. And I have to be honest with you, even as a nurse, we really never used that phraseology very commonly in practice. So even I was kind of like, why is everyone fixated on this? So let me start with the masks. All right. If you feel it necessary to have some masks for your home medical kit, I would recommend really looking for ones that have good bacterial filtration. Now, these ear loop masks, they don't fit tight. They let a lot of air in on the sides. They basically are helpful for if you sneeze or cough, from keeping snot and particles from just blowing around all over the place. I do want to read the side of this package though. So it doesn't give a list of all the things it is protecting against, but it does give you instructions for how to use this. And it also stipulates that it really reduces potential contact with fluids and does not eliminate the risk of preventing or contracting any disease or infection. So it is really more to protect your snot from going all over other people. All right, easy enough. We're all familiar at this point. Fits behind your ears, and it specifically says on the side of the box, change mask immediately if splashed with blood or bodily fluids. So I guess if you blow your snot all over the mask, or if someone else does, you probably are going to want to change that. That should go without saying. Now, less commonly, we have the N95 mask, which is the duck bill mask that's super uncomfortable. It has two different head loops that go back behind your head. Put this under your chin, put the straps behind you, and then tighten down the nose. I'm not going to be talking through that because it's really hard to hear and it's super hot. These are helpful if you're going to be in close proximity with somebody who has a viral illness like flu, chickenpox, somebody who has tuberculosis is mycobacteria. But anyway, you get the idea. These are so uncomfortable. They get super humid, super hot, and real mushy on the inside, so you have to change them pretty frequently. Gloves are something you must have. You don't want to be touching anybody's mucous membranes like the inside of their mouth or the inside of their nose, or touching any non-intact skin like sores, cuts, scrapes, burns, without having gloves on. And gloves are to protect you as much as they are to protect the person who you're helping. These are just standard vinyl gloves. I like the vinyl ones and the nitrile ones just fine. Too many people have latex allergies, so I would not really recommend the latex gloves unless it's kind of a last resort. And obviously, after you have gotten your gloves dirty, you want to peel them off very carefully and wash your hands. Enough said. I gotta redo the last part of my video because my video and audio disconnected somehow, and I had lots of audio, no video. That's not helpful. So I was going to show you. I have two of these Tyvek suits for our medical kit. I hope I never have to use them, because if I'm having to use them, then things have gone very badly. But they're basically a hooded onesie. I got them at the paint store, and they help to protect your hair, your clothing, and yourself from, I think, sprays, from large amounts of fluid. So I can't really even think of a time when I would really need to have one of those on, unless I were having to irrigate a wound that was really splashing a lot of fluid around, and I can't imagine having to do that at home. Now in the hospital I had to sometimes, but not at home. But anyway, it's good to protect you against things like moisture, spray, debris, and of course, like everything else, do take it off when you're done, single use only, throw it away, wash anything that got exposed when you had it on. And so with all of this PPE, you'll want to think about this. When you're taking it off, if you happen to touch it, then your hand is now contaminated and your hand needs to be cleaned really, really well. These are mostly indicated for single use, so use them once, throw them out. All right. The one thing I did not mention is a face shield, and really it's kind of like the Tyvek suit. It's for splashes to help prevent being splashed by something that's kind of gross or foul or contaminated. So it's just basically like the clear face shield you see people wearing sometimes. It protects your mouth and your nose from splashes. All right, and that's all I have for you today. Please give my video a like and give me a thumbs up. And I would love for you to hit the bell so you get notifications when my next video comes out. All right, this is Hillary, the Nurse Preceptor. Bye.